Hey, Seawolf community, Chancellor Sandine here with another segment of Ask a UAA Expert. Take a look.
My name is Hattie Harvey. I'm an associate professor of psychology at UAA and a nationally credentialed school psychologist. Today I'm going to be talking about children's mental health. What are some important guidelines or tips for talking with children about COVID-19? Children often look to parents and caregivers about how to respond to stressful events and situations. So when a parent is overly worried or anxious, it's often likely that that child's anxiety might increase. So in order to help cope and reduce anxiety that a child might be feeling, one of the first things to do is provide that reassurance. So reassure the child that our healthcare workers, their teachers, public school leaders, and our communities are doing everything they can to help keep them safe and healthy. Children also need factual information about the disease and the virus in order to understand and respond appropriately. So, for example, young children engaging in discussions about how to stay healthy and safe are the most important things. So certainly talking about hand washing and why we do it, because it helps keep us from getting sick. Some kids might ask, why can't I go to grandma's house, or why can't I have a play date? So being able to reinforce and use consistent language, we're not going over to grandma's house so she can stay healthy and not get sick. Second, we will also want to give them more, again, factual information. So elementary school children might ask questions, so use their questions to guide your responses. Their curiosity is important to validate and answer those questions. Again, helping them participate in their own abilities to respond to the virus around them, such as engaging in hand washing and social distancing and not going over to their friend's house. That helps increase their sense of control, and when kids have a sense of control, that actually helps decrease their own anxiety. And then lastly, we really want to validate what kids feel. So sometimes adults often think children's feelings might be irrational or not match the situation, but it's important to validate what they have to say, listen to what they have to say. And that actually helps increase their capacity for their own emotional development and problem solving, and be able to cope with what's happening around them. As a parent, I keep hearing about homeschool activities and setting up routines. How do I navigate all of this information and decipher what to do? Every family and household is unique, and that means every family and household has different situations. So what might work for one family might not work for another. So first of all, for parents, really giving yourself grace and allowing you to recognize what's important and what's going to work for your family, again, might be different from your neighbor, and that's okay. It's okay to adjust your expectations and shift to what's exciting and enjoyable in your own family. So this might mean engaging in meaningful activities that match your family's values or cultural activities, and adjust those expectations. Another piece is certainly being able to engage in the distance learning opportunities that your school or teacher provides. And again, connecting back to your family. What are the things that are making sense for you right now, and enjoyable activities? We know that young children, all children, learn from engaged hands-on exploration, and so being able to engage in those opportunities that you might come across or be able to do, whether it's going outside for longer periods of time, investigating wolves, those are all opportunities for learning. And then young children, we know, learn especially through play, and so allowing for open-ended play is going to be critical, and that is learning. Second, thinking about routines and schedules. You might see lots of things in social media or other families who are setting up their school at home. And I would just encourage families to know that routines are helpful for any child, even pre-COVID-19. But when we think about routines, being able to focus maybe on the things that you know are going to occur every day, such as your meals and bedtimes or your healthy habits. Because routines help establish expectations, they help children understand time management, they help children also just learn to navigate and develop some of those self-regulatory skills. So any routines you're able to do is okay, and then filter in and integrate, again, what works for your family. What are some additional resources to help guide parent and caregiver discussions with children? There are numerous organizations that have provided a lot of parent resources and guidance, and so I would encourage you to explore those that might work for you, such as 0 to 3 for families of young children, provides a plethora of parent resources around guiding discussions with toddlers and preschoolers, and as well as home activities that are play-based and open-ended. Other organizations, such as the National Association of School Psychologists, also provides a number of parent resources about talking to kids about infectious disease or how to cope with stress. So again, you'll see a number of links posted that might be good resources. There are also a number of social narrative videos that are being created that have come out to help children understand COVID in an interactive way, and those are also good options to guide discussions with your children.